This medication is used to treat or prevent certain types of bladder cancer. It works by causing the body's defense system to become more active. This form of the medication is not used to prevent tuberculosis. This medication is given into the bladder through a tube by a healthcare professional as directed by your doctor. It is usually given weekly for the first 6 weeks and then less often as directed by your doctor. Before treatment, do not drink any fluids for 4 hours. The medication stays in the bladder for up to 2 hours and then is released by urinating. Follow your doctor's instructions carefully. You may experience some burning pain when you first urinate. Since the urine contains live bacteria that may infect you or others, you must sit down to urinate for 6 hours after treatment to avoid splashing of the urine. After each time you urinate during this 6-hour period, pour household bleach into the toilet, then wait 15 minutes before flushing. Always wash your hands afterward. Talk to your doctor about other important things you must do to prevent infection. After your first urination, drink plenty of fluids unless otherwise directed by your doctor. This helps clear the medication from your body. If you experience nausea, vomiting, loss of appetite, or diarrhea, let your doctor know. This medication has been prescribed because the benefit to you is greater than the risk of side effects. Some people may experience signs of bladder irritation, muscle/joint pain, swelling of the testes, vision changes, or severe stomach pain. If you have any serious side effects or notice symptoms of a serious allergic reaction, seek medical help right away. This is not a complete list of possible side effects, so contact your doctor if you notice any other effects. This medication has live bacteria that have been weakened to reduce the risk of causing an illness. However, it has rarely caused very serious, possibly fatal infections. If you develop any signs of infection such as fever, chills, or cough, you should contact your doctor immediately. Before using BCG, Tice strain, Vial, it's important to let your doctor or pharmacist know if you have any allergies, as this product may contain inactive ingredients that could cause allergic reactions. You should also inform them about your medical history, especially if you have immune system problems, current infections or fever, certain blood vessel diseases, or if you have had any bladder procedures within the last 7 days. If you are pregnant, it's important to discuss the risks and benefits with your doctor, and if you are breastfeeding, consult your doctor before using this medication. When taking BCG, Tice strain, Vial, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with this drug include antibiotics, drugs that weaken the immune system, and mefloquine. Additionally, this medication may interfere with the tuberculosis skin test, so it's recommended to finish any necessary skin tests before starting treatment. If someone has taken too much BCG vaccine and is experiencing severe symptoms like fainting or difficulty breathing, it is important to call for emergency help. In the U.S., you can contact your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Make sure to attend all your medical and lab appointments. Be sure to use this medication as directed by your doctor. If you miss a dose, consult your doctor for a new dosing schedule. This medication is not given at home and is only administered in a hospital or clinic setting. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.